All right, we're back for another week of Doc Talks, and this week we have Dr. Wood back again.
What's up, everybody?
Getting our swimming on. So last time we talked a little bit more about the upper body with Dr. Wood. He spit his knowledge on head positioning, torso turns, all that kind of stuff. And now we're migrating down. We're going to go waist down. We're going to look at the proper flutter kick in swimming. So that's going to be a topic of today. So Dr. Wood, what's flutter kick?
Okay, well, I'm going to break it down nice and simple for everybody. Flutter kick, basically what we're doing is we're looking at a non-simultaneous kick where you're actually having your legs opposing each other continuously. Now that kick is going to be driven down from the hips to the knees, ankles, and feet, where the feet are going to be acting as your propulsion tool.
Okay. And so what other types of kicks are there? What would be something that...
Basically what we're doing is other kicks, or we're looking at a more simultaneous kick, or you're looking at a butterfly or a fly kick, which is actually the kick driven the exact same way, but instead it's simultaneous with both legs at the same time.
What does it change about your ability to propel or move in the water? The difference between doing alternating versus moving as one fin?
As one fin. Well, the thing is, with the butterfly kick, naturally a lot of competitive swimmers, you'll see that they'll start off when they come off the blocks, they'll be working a fly kick underwater just to continue with the momentum off the block, and then they build into a flutter kick and break out and swim. Now, if you try doing a butterfly kick with a freestyle stroke upper body, it's going to kind of look and feel a little bit awkward, definitely going to be a little bit slower.
Is that because, so you have two extremities going kind of simultaneous, and then the opposites are trying to do not simultaneous, like
right.
Opposites.
Right, and what you're doing is you're actually looking at a butterfly kick where you're getting more of a hinge point from the hips. So that's dealing more with short axis rotation. So short axis rotation, strokes being butterfly and breaststroke. Now with a long axis, you're actually looking more at a flutter kick because you're looking more at rotation for the entire body as opposed to a hinge at the hips.
Gotcha. Okay. So I feel like it would be kind of like doing like what is it?
Oh yeah.
Hey, I remember something.
Yeah, if you're doing one stroke and then you're doing a stroke on the upper, but it wouldn't work.
Yeah. Well, I mean, it makes sense to me. I mean, even just think about like walking.
Yeah.
Opposite arm, opposite leg. I mean, the walking analogy would be your freestyle or anything where it's single arm, single leg. So it makes sense that you wouldn't like. Although some people, I had a patient once where she would walk and she wouldn't move her arms at all, or she'd move them like this. It was really weird.
Like she could not do that?
It was the hardest thing in the world for her to like alternate arms and legs. It was bizarre. And like I want you to swing your arms, and she swung both at the same time.
Oh my gosh, that must have been.
Yeah, it was tough.
All
But
sorts of biomechanics.
we figured it out eventually, but yeah.
Could she swing afterwards?
Yes, she could. But so I would imagine it's the same thing though. It's like, so then the 2-foot comparison would be like jumping. So when I jump, I'm using both arms to propel myself forward. Yeah.
2 feet?
Yeah.
Okay.
I might try it. I'm assuming it's.
I don't know. We'll have to see how that goes. Hey now.
That's not easy.
Is that a fair comparison?
That's definitely a fair comparison, because when you're actually looking at the kick and what the kick is used for, kick's used for a couple different things. One, the kick is used for strength and conditioning when you actually look at it and break it down by itself. You can take it, direct and kick, its priority is also speed, especially with sprinting individuals, or even with closing speed for those who are distance individuals. And then you're also looking at the kick similar to the way you'd be looking at it with walking. You're looking at it as more as balance, whereas in the pool you're looking at it as balance plus buoyancy, because it's not going to do you any good if you're dragging your legs, pushing as hard as you can with the upper body, and the next thing you know you're still sinking, and then you're swimming upright, and the next thing you know you're calling for the lifeguard for help.
Yeah.
So it keeps you even keel, it keeps you a little bit more aerodynamic or water
Aquadynamic?
I like it.
I like it too.
It is today.
Is that a swimmer thing? Aquadynamic?
It's a swimmer thing.
All right. So where does this really matter for swimmers? What's the point of working on some of this stuff, and how do we start working on some of that.
Okay, like I kind of hinted on a little bit, when you're looking at where it matters for swimmers, so you're going to take the two spectrums of swimming or competitive swimming. You're going to have your sprinters, and then you're going to have your distance swimmers. Naturally, you have those ones that are in between too, but right now it's just for comparison.
Mm-hmm.
With a sprinter, you're just looking to engage the legs for more speed. So especially if you're looking to engage the legs for a lot more speed in areas where you're going to be getting into more of like anaerobic activity, you're going to be looking at getting more of a type 2 muscle fiber or a fast twitch muscle fiber activated a lot more than you get a slow twitch or a type 1 type muscle tissue activated. And for distance swimming, it's a little bit more of the opposite. You're looking to more innervate a lot more of the slow twitch muscle fibers, similar to how you would with a distance runner or a marathon runner, where you're activating more of that type 2 or that fast twitch more with the start and with the closing speed.
So for the people that maybe don't know, type 1 and type 2s are what?
Type 1 muscle fibers are going to be your slow twitch muscle fibers. Type 2 muscle fibers are going to be your fast twitch muscle fibers.
Cool.
So
Yeah.
sprinters, more fast twitch. Distance runners, more slow twitch.
More slow twitch.
And it allows you to, fast twitch allows you to produce more force or go faster, harder, more powerful than you can possibly imagine. And then the slow twitch is you go long, you go strong, and
I want to go fast.
And you want to go fast.
Ricky Bobby want to go fast?
You're the second person who's mentioned that movie to me this week, and I have yet to watch it. I know, for
Alright.
shame, for shame.
Talladega Nights, put it on the list.
So then, in regards to this, is there anything that changes with the mechanics of the flutter kick if you're going sprint versus distance aside from speed, or is it like you're doing the same mechanics but you just manipulate your training differently?
The biggest differences the biggest differences, especially in the water, is going to be your cadence. So especially if you're looking more at a sprint atmosphere, you're looking at maintaining that strong 6-beat kick. Some people can push an 8-beat kick, but not many.
Mm-hmm.
You're looking at a strong 6-beat kick, but that's also holding the cadence. So you're hitting 3 kicks per single stroke cycle.
Gotcha. Okay.
For a distance swimmer, it's going to be a little bit different. They'll start off with a nice strong 6-beat kick out of the gate, and then they'll move to more of a 2-beat kick, just to more hold a little bit of propulsion, but more cadence, because they're actually going to be depending a little bit more on the upper body for that.
Does that just make them, again, like if it's a slow kick or a 2-beat kick, that kind of keeps them level? That's basically what they're doing.
That's
they're not
what
trying
they're
to like push themselves forward. with
What
that,
they're
right?
doing is they're actually pushing themselves forward a little bit, but it's more meant to be able to keep the body properly balanced, to where if you're having a nice steady 2-beat kick, but it's small and compact, you're actually going to be able to keep the body rotation good.
Okay, so it's just an offset again, like when we're talking about like walking. You don't stop your arms and try to like just move your legs when you're trying to speed up your running.
Yeah.
You do the same pace with the arms and the legs.
Yeah. So I would assume too, it's kind of like sprinters. That's what I know more of is the faster you go, the longer your strides are, but then the more frequent they are. And then the
Yes.
slower you're going, vice versa. So it's essentially the same thing here. It would make sense that if I'm doing a fast swim, I would have a larger frequency of my steps or the flutter kick.
Right.
Versus if I'm going slow, I don't need to kick as fast.
Exactly.
Okay, cool. So, what is the cost-benefit ratio? Cost-benefit of the propulsive kick?
Cost benefit of the propulsive kick. Okay, well this also goes back and ties in, especially with sprinting and distance swimmers, but it also ties into people who are just looking to use kicking just more of a modality, or just use kicking more of a strength trainer or a cross trainer. Now, especially with more speed, more velocity, you're going to be required more oxygen to assist and aid the pathways for more energy production. However, once you start hitting a certain speed, you realize that the oxygen uptake is not going to be the same, or you're not going to be able to get a complete oxygen uptake to be able to cater to the muscle tissue to help promote that energy that you need. when that happens, then you start digging into going out of that aerobic cycle and start digging into more of an anaerobic cycle. So you start digging into more of dealing with glycogen, more of a glycolysis, where basically it's using of glucose to be able to promote energy to where you can go fast. Now, what happens is that the way that converts is, since you're not having that oxygen pathway, naturally glucose goes into the cell, converts into pyruvate, and then pyruvate converts into lactate. Well, basically what happens is those lactate stores are used, especially in issues of anaerobic times, or especially when you've got a lot of fast twitch going, you can only use that for a short period of time. Now, naturally, what happens, one of the byproducts of that is, of course, people manufacture a lot of lactic acid buildup. That's basically a lot of acidic buildup in the body, promotes what? Exactly. So you're having a lot more fatigue, ouchies. So that's the reason why
Like
sprints.
when Dr. Couples makes me do things that I don't like to do on here.
Yeah.
That hurts.
That's because you fast twitch.
Yeah.
You can't
That's
go
all I
slow.
got.
That's all you got. Hey, but you know when you got it, flaunt
I'm
it.
ready to go.
Yep.
So that's why sprints in the pool can only be held for so long. So naturally, when it actually comes time to more of distance, especially the energy that's expelled in the legs, you're more hitting closer to an aerobic base. So you're still able to depend on those oxygen stores to able to accommodate for the upper body, give yourself enough energy in the upper body.
Okay, so if, and people will come to you, I'm sure, for even technique advice or things that they're doing that maybe have promoted like an injury at some point, or they just don't feel like they're fast enough in the water. What makes a good kick? What are the things that you look for that are good, and what are the things that aren't good?
Okay, well, some of the things that are good and some of the things that are not good. First, you're looking to distribute your force properly. So in other words, you're trying to go into a straight line. You want to keep on that straight line. The way you keep that straight line is by pushing all that force back behind you. Mm-hmm. Now, when you're actually taking that force and you're not pushing it behind you, you're pushing it down, pushing it to the sides, naturally you're not going to be moving as fast because you have a bunch of different force vectors or different energy expenditures going in different directions. You're not getting it going straight back. Also, you're going to be looking at a person's depth of their kick. Naturally, when you look at a person's depth of their kick, you only want to go about 1.5 feet, no more than 2 feet. Part of the reason why some people kind of get it in their head that if I have a stronger kick or if I have a bigger kick, I'm going to be able to produce a lot more force, a lot more drive, I'm going to go a lot faster. In swimming, that's not the case because, like I said, when you actually bring the legs further apart, you're kicking harder, but you're not distributing your force straight back. You're going to be distributing your force down, you're going to be distributing your force up above the water, and that's just, in essence, going to slow you down. You're going to expel a lot more energy for no reason.
Kind of like a torpedo. I mean, they just shoot straight, and the torpedoes have a small little
They don't
propeller.
have things to go out this way, right?
Yeah, and there's not this drastic movement, so you want to stay in a straight line as you're going. So if you have too much extraneous movement, whether it's kicking way too high or it's kicking too far out, you don't have that straight line.
You don't have that straight line. And things that are also going to be able to help you in that straight line is you're also going to be looking at body's rotation. Now, when you're rotating the body, naturally when you have a kick going, you can have a nice strong kick coming from the hips. The thing is, you want to be able to have that contraction and rotation to where you can initiate a kick, similar to you would when you be kicking a soccer ball or kicking a football, where you're actually getting that core activation and then you're exploding with their rotation down through the hip and snapping down through the foot.
So core trunk stays a little bit more neutral, I'd say, and then the rest of the body is able to have that whip and that crack through the rest of the chain.
Yeah. Naturally you want to have that little abdominal contraction to where it's helping initiate some of that rotation, Because naturally, a rotating body in the water is going to exhibit a little bit more power and a lot less resistance.
So it can't be like you're flexing and trying to hold a six-pack like Zach the whole time. It's just
Yeah.
it's got to be kind of like almost cyclical, right? It's not like a rigid core. That would be, or a rigid torso, right? That's not the goal.
That's not the
The
goal.
goal is to be smooth with that, but again, maybe distributing the movement to 20% movement in this area, and then the rest of it you're trying to crack the whip.
Yeah, and that's the big thing. You're trying to crack the whip. You're trying to exhibit as much power as you can from the legs, so you can have Bodie Miller tree trunk legs like this man over here.
Hams.
So ham like bacon. Ham like bacon, baby.
All right. Okay, so if we're looking for exercises that could potentially help with the lower body, trying to train some of these things in like a dry land situation, we always look back to the things that we can help people with. We're probably not going to be out in the pool with someone, right? There's not a lot of times that I will take a patient, or you have probably taken a patient and take them into the pool and say, hey, you need to do this. But there's things that we can do dry land training that might start getting us into a better position, or at least training those things. What kind of things could we look at for different areas of the body?
Well, naturally, we're going to be looking at all the different areas. We're going to be looking at activation of the core first. We're also going to be looking at the proper activation of the hips. We're going to be looking at the flexion and extension at the knee. So that means we're going to be looking at that strong activation from both the quadriceps and the hamstrings, but then we're also looking at the mobility from the ankles. So we want to be able to have somebody that's going to be a little bit more toes pointed flexion based, or plantar flexion based, if you will. So that way they're going to be able to use the surface area of their foot to be able to snap through the water.
Okay, so you said surface area of the foot. How do people optimize that? What's something that they can do for an ankle or a foot positioning that's going to allow them to maximize their surface area?
What we're going to do is we're actually to maximize the surface area of the foot. That's right there it's going to really depend on how a person's foot is shaped if we're going to be able to maximize the surface area. That's kind of where genetics almost comes into play.
Okay.
So basically, if you're a person that has fairly wide feet, if you're a person that has fairly flat feet, you're actually going to be able to benefit from a flutter kick
Finally,
a little bit
flat
better.
Foot benefit, right?
Yeah.
And here's the best explanation I can give for that. So basically, if you're going to take a person's arch, so pretend that this is the arch of somebody's foot, the way I'm cupping my hand. Well, just like you're using your hand as a paddle, you're using your foot as a flipper or a fin. Now, if you have an arch that's relatively high, it's not the fact that you're going to be pulling a lot more water with a cup. That's not necessarily the case. The biggest thing is the amount of surface area that one person has. So if you have that cupped or that high arch, you're only having so much surface area that you're going to be able to propel with. Now, when you start to flatten that arch in a relaxed foot, then you're starting to exhibit a little bit more of a proper fin. So you're actually going to be able to have a lot more contact and surface area to be able to propel you. And last time I saw, I didn't see any whales or dolphins, with high arched tails.
Yeah. I mean, the bigger the fin, so to speak, the more power you can generate. That's like the difference between, if you took your hand and you moved it through water, you can go at a certain speed. But if you take a big flipper and you put that through water, you can just it's a lot harder. There's a lot more resistance that you can create.
Well, what you can do is you can mess around with that. So especially when you get in the water, go ahead, take your hand cupped, pull some water around, then flatten it out, pull some more water around, and see which one's going to propel you a little bit more.
All right, you heard it. You're going to go ahead and check it out. See if you need to grow your feet longer and flatten them out.
Longer, flatten them out, and make them wider.
There we go. Just big old paddles down there.
Yeah.
All right, so we talked about genetics of feet. Let's go up into maybe genetics of the hip, and what kind of maybe things do we consider as benefit to a swimmer, not a benefit to a swimmer? What kind of hips are we looking for?
Well, what we're doing is, since we're looking for a lot of mobility and flexibility coming down through the ankle, we're also looking for a lot of mobility and flexibility coming from the hip. The biggest problem with that could be a couple different things. It's if you have relatively tight hips, naturally you're going to be looking to try and get some more motion, whether it's coming from the low back, or you're going to try and just even force more motion at the knee, which you're not going to be getting that whip that you want from the knee, so you're not going to be able to exhibit much force. If you're actually locked up or really tight around the hip and you're trying to use the low back for any type of kick, that's when some of those low back injuries happen to occur every time you're flexing and extending at that pivot point somewhere in those vertebrae down there.
So with the kick, are we pretty neutral with our feet? Is there any turn? Is there any foot positioning that is typical that you see with a swimmer? Is there any rotation that happens?
Well, naturally, during the hip rotation, you have a couple of different motions that are actually going on through the legs. So especially when you're coming up and kicking the foot back down, you're looking more towards an internal rotation at the snap of the down kick from the hip. And then when you're actually rotating, come back up, you're looking more towards external rotation, a little bit more glute activation, bringing the leg back up.
Okay.
So does the leg almost go across in like an X?
The leg almost comes, so basically when you're rotating, the leg almost comes across. It never really comes straight up and down. When you're actually rotating, it's actually coming over and across and kind of just going more towards
kind of a C angle.
More towards a kind of a C, kind of almost light crescent shape.
Okay.
So the feet kind of orient like this, and then they go like this, because the pelvis, I mean, just from the little bit that I watched, the pelvis kind of does this little
Well,
rotation.
pelvis does its rotation back and forth with that flutter kick to help initiate the flexion and extension coming down through the hip.
All right. So you kind of hinted at it. Maybe a little bit of an overuse injury, or trying to move an area of your body that shouldn't be moving potentially with swims, would be compensation for the low back. What else do you typically see for a common injury of a swimmer that's using a propulsive kick?
Well, here's the best thing, especially with flutter kicking and swimming. You're not going to see a whole lot of injuries with the kicking. With the kicking itself, you're just going to be looking more at overuse. Overuse and fatigue, and then you happen to deal with muscle tissue strains. Other areas of concern would be more where you're putting a lot of pressure. So a person's putting a lot more pressure around their ankles when they're finishing off their kick. So especially with the ankles, you're seeing swimmers or people who've been kicking for a long time have relatively lax ligaments right around the ankles, especially around the outside. Now, especially in the pool, you can have issues where those can kind of flare up just a little bit, but just because of that ligament laxity, you're seeing more people suffer just ankle rolls, especially just more with dry land activities.
Oh, okay. So they kind of get used to being in the water so much, or have those stresses from the water so much, and they don't have the integrity around the ankle to cut and move and maneuver on land. That's interesting.
That's fairly common in swimmers too, isn't it? To like, if you got someone who's very good in the water, usually on land, they're
It could be a hit or miss. It could be a hit or miss with both, and especially with a couple of swimmers that I had coached a long time ago. Amazing in the water, and when they came out and did any type of dry land strength and conditioning, coordination was definitely not there.
Yeah, that's just different forces you got to deal with,
I'm just thinking of a couple of patients I've had that had trouble with plantar flexion and trying to get the feet to kind of go down. They would get these nasty pinches in the back of the ankle. Some of them actually we send out for imaging, and there is actually some like bone ossicles or like extra bone tissue back there. I'm just thinking have you ever seen anybody that has like a pinching type pain with that, with being in that position for so long? I feel like that would be maybe an irritant, maybe not. I don't know.
Well, the thing is, especially when they're in that position, a lot of the times they're getting the contractions back through the lower leg or back through the calves, if you will. But those contractions are not, how should I say, they're not really heavy. Because more you're looking to keep the foot passively relaxed.
Okay.
So if you're keeping the foot more passively relaxed, you're going to be able to have a lot better generation as far as power through the water.
Gotcha. Again, so not a rigid like I'm thinking. I'm thinking someone's going to be pointing their toes and they're going to be doing something like this for a long time. That doesn't work like that, I guess.
Kind of want to see that. Yeah,
That's pretty neat. We can maybe do that on synchro swimming.
yeah.
Okay, so I'm wrong. But again, that's why we have an expert for swimming that can right my ship. Aha.
Hey,
The water pun right there. I see
hey.
what you did there.
There it is. All right, so we had some low back irritation. We had some ligament laxity due to just too much training in the water. Those are things that we need to consider when we're looking at injuries for swimmers. And then what kind of stuff can we look at for basically not getting into that situation? What kind of stuff can we do for recovery and tissue prep and that kind of stuff?
Well, the biggest thing before you're going to be getting in the water is naturally you just want to go through some regular mobility exercises, and whether that's actually just working arm circles, working legs to where you're actually just working kicks from the hip, whether you're going through and working basically cars where you're just going and working on going through the complete mobility, especially with the ankle, working internal and external rotation with the hip, just getting all those areas warmed up and mobile before you're getting in the pool. Other areas that you're going to want to focus on is you're just going to want to focus on a good diet. Ideally, that person who is looking to more do sprinting, if they actually have decent glucose stores within the body, they're going to be able to get through anaerobic activities a little bit easier than somebody who basically hasn't been eating anything all day or has been eating very little before they're getting into a heavy practice.
Okay, so I mean, obviously, if we deplete, energy stores and stuff like that, we probably don't have the best thought process. We're tired, we're fatigued. I can see how that would definitely mess with mechanics. Ultimately, cause a flaw in how we're propelling ourselves through the water.
Well, not only that, it just leaves you just more susceptible to injury, especially with fatigue if fatigue sets in too soon.
Yeah.
So your mechanics might be compromised, and that's usually when problems ensue. When you have a reduction of the efficiency, or you're overloading areas, or you go into, the restrictions that you mentioned that could compromise the mechanics. Well, those might manifest even greater because you're tired.
Yeah.
The less motion you have available, the more efficient you are from an energy storage or energy usage standpoint.
Yeah.
Exactly.
Have you worked with any swimmers, nutrition-wise?
Not nutrition-wise, no.
Swimmers, though?
We're
Not
getting,
Not too many, no.
get ready to.
Yeah.
Get ready to.
I haven't worked with, I'm just trying to think.
I think I've had like some triathlon types,
Yeah.
but not strict swimmers So
Well,
I can't say I have a lot of experience with those types of people.
No. But I mean, like, the overwhelming majority of people nutrition-wise, even though you can take advantage of things of having carbohydrates at certain time periods to maximize your glucose uptake, if you're not doing a lot of the fundamentals, like, I don't know, eating vegetables with every meal and stuff like that, like there's other low-hanging fruits. There's my pun for the day.
You got it.
Boom!
You got to put it in there.
Low-hanging fruits that you can get that still will help with energy production and also reducing inflammation and things of that nature. So I'm sure you hit that up because that's
Who can help with that?
important. Well, there is a PT and one of the docs here who does do some nutrition coaching. If you do need help working your way through that, we'll give you the number later.
And then for any of your questions on biomechanics of swimming, efficiencies in swimming, injuries pertaining to swimming, we're going to defer all of our questions to Dr. Wood because he's going to be the one that's going to give you a little bit better guidance on how to get through that stuff and be able to treat that a little bit more efficiently. And he can speak, talk to talk, walk to walk, or swim to swim, whatever you want to say.
Well,
So,
you were a rock solid swimmer in your day.
I
You still got it, brother?
I was okay. I
He
still
dabbled
a little
in
bit.
swimming.
I dabbled a little bit in swimming.
Yeah, yeah.
Yeah.
For those of you who don't know, two-time All-American?
Two-time NCAA All-American at UNLV.
That's awesome.
Go Rebs.
Go Rebels. But if you do want to reach out to Dr. Wood, myself, Dr. Booth, whoever you need, you can book a free discovery session with us, 30 minutes, where we can kind of talk you through your problems and guide you to where you best need help, whether it's with us, whether it's with someone else. 702-558-2151.
Boom.
Burned into my brain to help out you wonderful folks.
All right, guys. Well, that's it for this week. We'll be back again next week for Doc Talks. Same time, same place. We'll see you there.
Take care, everybody.